Bags and under eye wrinkles treatment. I'm looking for the best options for the bags and under eye wrinkles when I smile. I am 39 years old and would like long-lasting results.
Thank you for your question. You submitted several photos and you stated in your question that you're 39 years old and you're concerned about basically two main issues: the under eye bags as well as the wrinkles under your eyes when you smile, and you're looking for long-term solutions. Well, I can certainly give you some guidance as to how I approach these types of questions in my practice. A little bit of background: I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and treating patients with the under eye bags and wrinkles around the eyes is one of the most common issues that we deal with in our practice. And it's very important that you really understand the basis of any suggested treatment, because when you look for solutions, you are going to be overwhelmed by the number of solutions that are being offered. So to begin with, the first thing is to understand is how to separate the anatomical basis for each of these problems and how I generally approach these particular issues. Let's start with the under eye bags. The under eye bags represent something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat pockets that are normally around the eyes pushes forward and creates this bulge. And that bulge remains whether you have a lot of rest, whether you have plenty of sleep or no sleep. There's often a tremendous amount of puffiness that lingers all the time. Generally, this is a genetic trait, and very often people say, I inherited this from a parent, and will also state that they've had some form of under eye bags ever since they were teenagers. So when it comes to under eye bags, the strategy for someone with the level of puffiness that you have is a surgical strategy. And even though that might sound a little bit intimidating, it's actually the most definitive procedure in my opinion. When you look at possible solutions, you're going to also see the possibility of use of a filler, such as Restylane or Juvederm, to try to hide the bags, and which is something that we do also in our practice. But when I see people with beyond a certain threshold of puffiness, then the definitive procedure is usually something called lower eyelid blepharoplasty. Lower eyelid blepharoplasty means that we're doing a surgical procedure to address the under eye fat pockets. Now the question is, do you do this to remove skin, or do you do this without removing skin? Well, in my opinion and my experience, most of the time, especially someone who's only 39 years old, there isn't an issue of excess skin. It's more of a quality issue. So I would typically do something called a transconjunctival blepharoplasty. This is a procedure where the fat pockets are addressed from the inside of the eyelid. This way there's no external scar and the true shape and contour of the eyes remain the same. This is very important because a very common problem with the external approach for a lot of people is that they end up having a lower eyelid retraction or sagging or a change in the shape of the eye. And it's been my experience that this approach has been consistently successful, and I've been at this over 20 years. Now, that addresses the fat pockets. What do we then do about the skin quality? Because a lot of times people will think, what about all the excess skin? They naturally think that if someone, let's say, does liposuction for fat around the stomach, that they would have extra skin around the eyes like you would have if you lost a lot of weight around the stomach. Well, the anatomy is different. It's not a question of skin sagging, but it's about skin quality. For skin quality, I typically do a combination of laser using something like fractional CO2 laser, and I use something called platelet-rich plasma. Platelet-rich plasma, or PRP, is derived from your own blood, and it has all the growth factors that are necessary when you have an injury. And what that does is it stimulates collagen, blood supply, and other things that help improve skin quality. So we work from the inside and the outside using the laser for the outside, PRP for the inside. Now, as far as the wrinkles when you smile, this falls under a category called dynamic wrinkles. Dynamic wrinkles are wrinkles that result when muscles are activated. Now, dynamic wrinkles cannot be treated permanently or long-term the same way as fat pockets because the muscles responsible for this contraction are important for proper eyelid function. But what we can do is use a drug like Botox or Dysport to relax those muscles. Or the drugs can be used to reduce the contraction of those muscles so those wrinkles become less pronounced. Now, in terms of long-term results, you are dealing with certain things like a surgical solution for the fat pockets that does have a very good long-term benefit, 5 to 10 years, depending on a person's aging process, and the fat pockets usually don't come back in the same way. If there's going to be a little bit of fat prolapse, you can always do something later. But as far as treatment for skin quality and for the dynamic wrinkles, usually that involves some type of maintenance process or maintenance plan. And it depends, and it has always customized to the individual patient. So I recommend you meet with qualified, experienced cosmetic surgeons and learn about these options, and don't be intimidated by the surgical solution. In my practice, going back 20 years, I made it a mission to try to simplify and reduce the things that cause the greatest anxiety for patients to consider surgery. So in our office, we have Joint Commission certified facilities, and we do everything under local anesthesia with light sedation, which means that basically it's like you come to an office which has the operating room, has staff that is familiar with you and you'll be comfortable with, and we do this with local anesthetic with a little bit of sedation. So we avoid general anesthesia, and it's somewhat comparable in some ways to just getting injectables. And of course it is still a little bit more involved than that because it is still surgery. So I hope that was helpful. I wish you the best of luck, and thank you for your question.